This is Dr. Kathryn Dao reporting for Room Now. I'm at EULAR 2022 in my living room from Dallas. So I want to share with you this poster. It is fabulous. It's actually poster number 0086, and it's looking at real-world patient preferences in lupus patients who are willing to undergo risk in order to get the treatment outcomes that they desire. So what this study did was they took 342 patients with lupus, and they gave them hypothetical situations. There were more than 3,400 observations that they obtained. And they wanted to know whether or not patients place greater value on symptom control or whether they place greater value on medication side effects like infection. And what was interesting was the way that patients rated as having greater values, which is actually symptomatic improvement. They rated the most important issue to them is actually controlling their joint pain, followed by controlling their rashes, particularly the itchy rashes, and then also non-joint body pain and fatigue. Now, what's interesting is that reducing risk for infection, that actually came in last as in terms of importance in treatment outcomes. So this is an interesting study because there's a disconnect between what patients want versus what physicians want. Patients were willing to tolerate risk of side effects in order to achieve improvement in their outcomes. So this is Dr. Kathryn Dao reporting for Room Now. Follow me on Twitter at KDao2011. Hi, this is Dr. Kathryn Dao reporting for Room Now. I'm at EULAR 2022 in my living room in Dallas. So I want to share with you this poster 0365. It's looking at hematologic relapses in patients with severe disease. It's looking at the Atacon lupus cohort, ATTIKON lupus cohort. So that's about 800 patients. About 40% of them had severe hematologic, sorry, Jonathan. This is Dr. Kathryn Dao reporting for Room Now. I'm at EULAR 2022 from my living room here in Dallas. So I want to share with you this poster. It's poster 0365. And it's looking at severe hematologic relapses in patients with lupus. And this is from the Atacon lupus cohort of 800 patients. They found that about 40% of these patients have hematologic manifestations, of which 13% had really severe disease. And their definition of severe disease is having thrombotic microangiopathy, platelets of less than 30,000, hemolytic anemia where the hemoglobin is less than 8, or macrophage activation syndrome. So these are pretty severe hematologic, demand right in your face kind of manifestations of lupus. And what they found were that about a third of these patients had hematologic issues that preceded the lupus diagnosis. Now, these patients were pretty responsive to receiving rituximab or cyclophosphamide, but there were relapses. About 50% of patients will relapse, but these relapses will respond to glucocorticoids, IVIG, and plasma exchange. So there were no deaths, though. So that's something to consider. If your patient has a severe hematologic manifestation, continue to monitor them very, very closely. This is Dr. Kathryn Dao reporting for Room Now. Follow me on Twitter at KDao2011.